I now give the floor to the Honorable Jone Usamate, the Minister for Health and Medical Services.
Madam Speaker, I rise to express my support for this momentous 2015 budget. The first budget that this country has ever had as a true democracy. A democracy in which every person in this country, in accordance with God's will, has been treated as an equal human being for the very first time ever. It is not a weak and impotent budget. It is visionary. It shows true leadership, true courage, and real consistency. There have been some terms used by the other side to describe this budget. Ambitious, not for the poor, boring. Let me deal with each of these terms, one by one. Ambitious, yes, it is ambitious, because this is an ambitious government. We have set high targets. We want to build a better Fiji, a sustainable democracy, a growing economy. We aim for the stars, because if we miss, we might land on the sun. If we just aim for the mountains and we miss, we might just end up on the side of the mountain or the bottom of the mountain. We have imagination in this government, and imagination is a powerful thing. But we are not just dreamers. No. We are here to back it up with action, with execution, with strategy, and with results. Madam Speaker, many of the honourable members in this House have been speaking in parables and stories, so I thought I'd join them. A good Iranian friend of mine that I met a few years ago, he told me about 3 different kinds of people. The first kind of person walks up to the door, tries it, and finds that it's locked. He turns around and walks away. That's the first kind of person. The second kind of person walks up to the door, finds that it's locked. He asks around for the key. When nobody has the key, he walks away. The third kind of person, he walks up to the door. He tries it. He finds that it's locked. He asks around for the key. Nobody has the key. He makes a key. That is what describes this government. That is what this government is about. We are key makers. We are not satisfied with the door being locked and the key not being available, but we will make the key. The Bainimarama government that preceded this Fiji First government always found that the door was locked in things that prevented our progress in the past, and we've always made keys to make sure that that door was open. Over the past few years, we have realized that if we keep doing what we have always been doing, we will always get the result that we've always had. So if you want a new result, you have to do something new. And that has been the hallmark of this government these past few years. We have seen policies put in place that have led to growth. Reduce personal income taxation, to increase discretionary income, to increase spending, demand and consumption. Reduce corporate taxation to encourage companies to come and invest. Enhance infrastructure development at an unparalleled level never ever before seen in this country. And on top of this, a new constitution that provides new socio-economic rights, a real revolution for this country. What happened as a result of this? Let me tell you what happened. Growth levels in 2013 at 4.6%. Growth forecast in 2014 at 4.2%. And growth forecast for next year at around 4%. 3 years of growth above 4% forecast. Unprecedented in the annals of Fiji's history. Unprecedented. Madam Chair. There have been statements to say that this budget is not for the poor. Let me address that issue. I think if somebody says that this budget is not made for the poor, it reflects a poor understanding of the budget. Here's the thing. Here's the thing. Let me say this slowly, in case you don't get it. Let me say this slowly. The measures that government plans to address the poor are not only found in the budget of social welfare. It is found in the budget as a whole. The budget as a whole. Let me take you to page 57 of this booklet. If you find it, you will see there, I need my glasses for this. you will see there are a whole range of activities that government is doing for poverty alleviation. Under social welfare, poverty benefit scheme, child protection, social pension, food voucher, women's plan in action, grant to girls' home, so forth. Under education, bus fare subsidy. Under health, free medicine. Under Department of Housing, Langi Housing Development Project, social housing policy, informal settlement, and so on. Under the Prime Minister's Office, funds for the education of needy children. Under strategic planning, Northern Development Program, and so forth and so forth. One needs to be able to understand the budget and see the whole budget to understand the impact of the budget on various parts of our society, such as poverty. In essence, the part that I've just read, in addition to social welfare, talks about around at least 150 million focused on those at the lowest echelons of our society. There's been another statement saying that it's boring, that the budget is boring. This is one thing that I must say. Once you develop a new approach, you must have the conviction to go through with it and keep at it. That is exactly what we have done. We have been consistent these past 4 years in the way that we have addressed budget. One thing investors need is consistency in the long term. That is one reason the investment has been low in this country in the past, because policies have not been consistent. Now we have that consistency. The government has been consistent in its policies. This has bred confidence, and that has led to investment. The result of all of this, 29% of GDP investment in 2013, 26% of GDP in 2014. The first time that we've had consecutive years in which investment is above 25% of GDP. And never before have we ever had that in the history of this country. They don't get it. This government has shown, it will continue to show tenacity, it shows bravery, courage, a willingness to go beyond the normal, a willingness to go beyond the conservative, consistency in focusing on growth that has an impact on everyone in this country. Those in the villages, those in the towns, the cities, all the different ethnic groups, all classes of our people, all generations. Consistency these past few years in putting in place the conditions that will allow a sustainable democracy to be developed, a democracy that would sustain itself, Madam Chair. We also aim to eradicate corruption, eliminate the race-based politics that have been our downfall, to strengthen institutions, to take the politics out of the sugar industry and thus begin the road to recovery, all essential steps. The learned Shadow Minister for Finance, in his reply to the budget put forth by the Minister for Finance, was not able to provide any useful suggestions for moving the country forward. There have been few, if any, innovative and long-term focused suggestions from his colleagues on the other side of the House. Perhaps I should say the other third of the House. I am tempted to refer to some of the comments I've heard in this House from the other side as shallow, myopic, narrow-minded, bigoted, and short-sighted, but I shall not. Government has been accused of not understanding the mind of Itoke. Strange. The vast majority of this side are in fact Itoke. We understand our own minds, so we must obviously understand the minds of Itoke. The old mantras don't work. The only constant in the world is change. Change will happen. Change has happened. Culture changes. Language changes. Everything changes. Our Itoke culture has always evolved. The Itoke culture and the Itoke mind of 500 years ago is not the same as the Itoke culture and the Itoke mind of 200 years ago. It's not the same as that 50 years ago, and it's not the same as the one that we have today. We need to keep up to speed with all this. The Itoke in a traditional setting is different from that in a modern setting. The way that they think is different. One of the greatest gifts that mankind has ever received these past years in this country is the knowledge that all people are treated equal. That is such a liberating thought. Fiji's long-term future for this country depends on two things, or at least two of the things that lead to that growth. One, a lot will depend on our ability to maintain consistency and stability, and secondly, our ability to build strong institutions. We must build strong institutions in the country. It is these things that build confidence and equity in any country. And that is what this government has been doing all along. And we are seeing the benefits now. There is a renewed vigor. There is a climate of change. There's urgency in the air. There's optimism. There's confidence, Madam Speaker, sorry. All this has been built on a constant focus of delivering, on making promises. The promises that were made in the Constitution, they are being delivered. The promises that were made in the Fiji First Manifesto, they are being delivered through this budget. That's what we mean about delivering on all the promises that we've been making. Government has shown clearly its emphasis on pro-development and for caring for all. The people have taken note of this, and they have roared their approval. An election has been won on the basis of treating everyone equally and fighting for development, and not on scaremongering and pampering to the return of yesteryear. People will no longer be fooled. Madam Speaker, there can be no wealth without health. Health, in fact, is our wealth. Our vision in government has been a simple one: to build a better Fiji. A better Fiji also means a more healthy Fiji. The Bainimarama government has had to deal with and fix years of neglect, and this has been done. I appreciate those who have served as ministers of health in the Bainimarama government before me, both of whom are in this House, for having started us off on the road to recovery. This is why this particular budget has placed a lot of emphasis on health. There is in this budget a massive increase for the ministry of more than 47 million to a total of 269.7 million, an increase of 23%. That is a reflection of the importance that we attach to the lives of our people. All countries in the world face pressures on their health systems. Even the developed countries face these pressures. They all face rising demand for service. Here in Fiji, given the level of resources that we have, we may not be able to provide the same level of advanced care that our bigger and richer neighbors provide. But Fijians will get there. We will make sure that we can provide them the very best and most up-to-date and capable care possible. Facilities that are accessible, as well equipped as possible, and professionally administered. Madam Speaker, I would like to highlight some of the key features of this budget. A lot of the speakers that have spoken before me have spoken about the massive increase this year in terms of the human resources, so I will not talk about that to much extent. But one of the things that I must say, if there is a focus over the next few years in the Ministry of Health, there will be a focus on service delivery. And for service delivery, you need people. People who know what they need to do, people who are switched on, head, mind, and also the attitude must be right. And that is something that we'll be focusing on. We will be focusing on strengthening our performance management system to incorporate the soft skills, not just the hard skills, but the soft skills, to include quarterly reviews and performance improvement interventions. We'll be focusing on improving our culture in the ministry, to focus on all the values that we have: customer focus, integrity, faithfulness, loyalty, and so forth. We'll make sure that we provide money for the capacity building of at least $1 million through the government, and hopefully more through the work of development partners. And as part of the civil service reform, we'll also be looking at enhancing leadership structures and capabilities and ensuring that we have the right leaders in place. Leadership is critical to achieving our aims. Good leadership leads to good results. Leadership is critical at all levels for execution. Infrastructure, there's been a lot of comments made on the infrastructure that we have in the Ministry of Health. Extension of hospitals, Lotoka Hospital Emergency Department, improvement of health and nursing stations. Makoi has been talked about, the Nyumba Hospital, Nausori Hospital, the upgrade of Keasi, Valley Level Health Center upgrade, Rotuma Hospital, New Naulu Health Center. And in addition to this, you will find also that there are aspects of improvement in the health sector that is not in the Health Ministry, but also in Ministry of Rural and Maritime Development. And that includes the relocation of the Nadula Health Center and the construction of staff quarters of Rambi Health Center. Total investment in excess of $40 million. And as we speak today, Madam Speaker, we are about to open or commission the extension of the maternity unit in Singatoka, and also the Dubu Health Center and the Watukarasa Health Center. Those will be open shortly. Over the next 6 months, we expect to be opening the CWM hospital extension of the operating theatre and the post-anesthetic recovery unit, and also the Lautoka Hospital Emergency Department Phase 1. There's also been, in this budget, there's been a realization that if you want to be able to provide high service delivery, you must have the equipment in place to deliver that service. And in the budget for 2015, Madam Speaker, we have money that has been set aside for equipment for urban hospitals, equipment for health centers and nursing stations, dental equipment, biomedical equipment, and accident and emergency equipment to the tune of more than $7 million that will be implemented in 2015. And we also have one of the things that we have realized in the health sector, that as a ministry, we need to focus on core business. We need to make sure the efforts that we put in things that are not core business need to be given to those that can do it better. So areas like security and cleaning have already been outsourced, and this will be propagated out to the rest of the country. Outsourcing to the tune of 2.5 million. Other special expenditures will include the Pacific Health Ministers meeting, where we will be revisiting the vision that we had for health in the Pacific Islands, of healthy island concept. That concept will be reviewed this year. A range of programs. The ministry will continue with its outreach program, where it takes its specialist services and takes it out to the members of the community, to our citizens in Fiji, so that they do not have to come to the hospitals, but we take the service out to them. Health system strengthening, health information system, all of these will have money that have been set aside for them, including family planning. There's also a range of programs that will be delivered next year in family health, public health, community rehabilitation, the Fiji Adolescents Reproductive Health Program, food supplements for malnourished children, child health development, baby-friendly hospitals, community health workers, primary eye care, oral health promotion, cardiac, oncology and cancer, typhoid prevention and outcome, all to the tune of more than 1.2 million, Madam Speaker. One of the things that we realize also, that health is something that cannot be addressed just by one ministry. In order to address the health of a nation, it has to become the whole of society approach. We need to get everybody on board. We need to get the government on board, the private sector, the civil society organization, NGOs. That is why within the ministry we work together with our partners, and there are operating grants that are transferred to these agencies so that they can also work towards the vision of a healthy population in this country. Some of the organizations that will be supported in 2015 include the Kidney Foundation of Fiji, the Chanel Home of Compassion, Father-Law Home, the Reproductive and Family Health Association, the National Blood Service, St. John's Association of Fiji, local rural authorities, and the National Food and Nutrition Committee. Some of the other areas that we'll be looking to continue that has been set in place by my predecessors in the past is providing overseas medical and consultancy to those that need referrals, to above the tune of 1.3 million, overseas visiting medical team, transfer expenses, transport of patients, minor works in hospitals, in subdivision hospitals to the tune of 860,000. Also, Madam Chair, within the budget you will find that all the promises that we've made in our manifesto will be delivered, because that is the basis of this budget, that we will deliver on all of our promises. Just to close up, Madam Speaker, at the end of the day, if there's a number of things that we will continue to focus. We will continue to focus on the decentralization of services, on bringing health services right to the doorsteps of everybody in this country, as much as possible as our resources allow. We will continue to focus on the enhancement of our tertiary services, the development of CWM as a tertiary hospital, and also the new one that will be developed in Lautoka as a result of the Fiji First Manifesto. We will strengthen our preventive focus, especially on NCDs. We want to prevent people from having to go to hospitals in the first place. And the other area that we'll be focusing on in 2015 is to re-engineer processes. I am a great believer in process re-engineering, that if we fix the processes, the outcomes will be improved. And with all those, Madam Speaker, it is my honor and my pleasure to commend this budget to the House.